Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over Atrial Fibrillation Awareness Month. So September is National Atrial Fibrillation Awareness Month, and unfortunately, my wife used to have this, and currently it's cured, but a lot of people have this. A lot of people don't even know that they have AFib until it is too late, and so people need to be aware of what this is, and so September has been made to be aware of this. So pictures mean 1,000 words, and so AFib Awareness Month means awareness, education, and impact. So, and this is indicative of this through the Heart Rhythm Society. So raising awareness, improving care, changing lives. So the main thing is that people over 40, 25% of them have atrial fibrillation. So we can close the gap through education, prevention, and action. A lot of this is for patients and families, and so info sheets, again, are really great for this. These are some things that you can provide patients to providers for providers, or you can you can watch this on yourself. So patient resources, here's some resources. You can sign up for this, and as you see, you can have some of these information of what general AFib means. And there's an info sheet, there's a video, and as you can see, there's multiple documents. And a lot of times, it's very difficult to maneuver through these documents, but you can do so. And then, so what we can do, what we see here is that Centers for Disease Control and Prevention predicts 12 million people in the U.S. will have AFib by 2030. That's a good chunk of people. And so if you can think about AFib as something that is that may be a possibility, then it's important for you to keep that in mind. AFib is a problem with your heart function. This is what they have provided in this worksheet. So AFib is a problem that how your heart functions, causing an irregular heartbeat. With AFib, your heart may beat too fast, switch back and forth from fast to slow, or skip beats, preventing your heart from pumping blood to the rest of your body normally. AFib may start suddenly and then stop on its own, or it may become a long-lasting problem. It is an illness that can become worse if it's not treated. A lot of times, many things are seen as negative, but being aware of this and making this more amenable for people to understand is important. One of the ways that my wife looked at this is through the rhythm strips. Cardia has some really great technology where at the end they can tell if it's a normal heart rhythm, heart with AFib or something else. So I've seen so many strips in my medical training, and seen in the cardiac strips that my wife has. I really I'm able to tell what that looks like. So this is a normal heart rhythm. There's no irregularity here. Atrial fibrillation, you have a short heartbeat. Of course, this is for those that are providers, P, Q, R, S, T waves. And so this shows how there's irregular heartbeats. And so atrial fibrillation patterns are associated with arrhythmia, progression, and clinical outcomes. This is a paper that was written in 2018. So if you want to, you can find this on Google Scholar. So there's two types of AFib. One is paroxysmal AFib. This type of AFib occurs occasionally and then stops. An episode may last for seconds, minutes, hours, or days before the heart to its normal rhythm. People with this type of AFib often have more symptoms than others. As the heart goes in and out of AFib, the pulse rate may change from slow to fast and back again in short periods of time. And so when she had it, she had kind of like slow to fast and back again sometimes. Um, but hers was more constantly, irregularly regular. Um, what are the causes? Well, it might be due to heart surgery, heart valve disease, coronary artery disease, or high blood pressure. And that's something my wife had previously. Or perhaps thyroid disease, sleep apnea, lung disease, or lung cancer. Drinking too much alcohol, being seriously ill, or having an infection. Um, so the signs and symptoms are irregular heartbeat, fast, slow, or both, heart palpitations, feeling overly tired or having low energy, shortness of breath, chest pain, pressure, tightness or discomfort, dizziness, lightheadedness, or fainting, or no symptoms at all. Um, it is important to see a doctor, and the risk factors, here you go, laundry list. But advanced age, 60 or older, high blood pressure, obesity, these are the most common. Of course, European ancestry and diabetes also, and heart failure are also some problems. Um, this is a risk criteria, and this is something that I've used with patients previously. Congestive heart failure, hypertension is one. Age greater than 75 years is two. So this is how the points are given and added. And as you can see, female sex is one as well. Um, so people with AFib are with 5 times more likely to have a stroke than those without AFib, and the strokes are worse. And so this is where sometimes when the strokes are taking place um, afterwards there could be more AFib. So some of the diagnosis is made through EKGs, Holter event monitor. That's something my wife had gone through as well. Echocardiogram, transthoracic, transesophageal echo, CT, MRI, and an Apple Watch. Digital wearables have revolutionized how atrial fibrillation looks at. When you have a problem, you can go to an electrophysiologist, or it can be treated by AFib diagnosis, medication, blood thinners, which she has, procedures, interventions like ablation, or lifestyle modifications. Um, every patient is different. Four main strategies for managing this is rate control, rhythm control, stroke prevention, and risk factor management. See a doctor early if you are experiencing signs of AFib. So similarly, there's a lot of videos, a lot of researches. I know many times there are difficulties in discerning a lot of these lot of these documents or uh, pamphlets, but very important to kind of look at the highlights and see what's going on, or go to a medical patient advocate that might be able to interpret these way more than a patient. Um, so see a doctor early if you're experiencing this. I hope this has made some sense. Thank you for listening.